People who do drugs are bad, violent criminals. This is the attitude that American society has long taken on in response to drug abuse and drug overdose, um, aka the war on drugs. Um, there have been many factors that have influenced the war on drugs, but more importantly, it has resulted in individuals not being able to get adequate treatment for their condition. I am here today to argue that American society should move away from prohibition and instead move towards rehabilitation and regulation. First, I'll be going through some of the problems associated with the war on drugs, then I'll be going through some of the causes, then my solutions, and then finally, my conclusion. So first, in terms of some of the problems associated with the war on drugs, one is that the war on drugs actually exacerbates the issue, and this is seen both domestically and in terms of international relations. So in 2017 alone, there were more opioid-related overdoses compared to the casualties from Afghanistan, Iraq, and Vietnam combined. And this was found by the Harvard Journal of Law and Public Policy in spring of 2019. In terms of the international community, in 1961, the Single Convention on Narcotic Drugs reaffirmed their goal to basically eliminate recreational drug use. This was stated by the Brown Journal of World Affairs on June 1st, 2021. America has largely aligned with this goal and in fact collaborated with Mexico in an anti-drug campaign, which again, it only exacerbated the issue. In 2018, a record high of 30,000 people were killed in relation to drug cartels in Mexico. Another problem associated with the war on drugs is the fact that it is heavily criminalized and consequently people who need help aren't able to get it because of the lack of resources. In 2018, the Indiana Law Review found that 23 million people have opioid use disorder, but over 60% of them do not have access to the adequate medical and evidence-based resources. Another issue with the war on drugs is that it results in racial disparities. The American Civil Liberties Union in 2020 found that despite similar usage of marijuana, Black Americans are 3.73 times higher to be arrested for marijuana usage compared to white Americans. Another issue with the war on drugs is that it has resulted in excessive spending on both a state and federal level. It has been estimated that $1 trillion has been put towards the war on drugs, as stated by the San Diego International Law Journal on April 1st, 2021. Yet there has been no reduction in drug usage, drug-related crimes, or drug overdoses. So some of the causes of the war on drugs. The Cleveland State Law Review sort of highlights one of these causes as moral panic. And what moral panic really is when politicians at both a state and federal level feel the need to find simple and effective sort of slogans and campaigns to show people that they are really taking steps towards stopping or solving a problem. And so in this case, a lot of politicians have rising crimes and in response have promised sort of this action of war on drugs. And as you notice, this sort of moral panic has resulted in very negative language associated with drugs. The quote in itself, war on drugs, which was coined by Nixon, sort of seems like instead of helping people who are dealing with drug addiction, we're sort of fighting against them or in opposition against them. Sort of hand in hand with moral panic is heavy policing and heavy prohibition. This was sort of started with Nixon and sort of reestablished with Reagan-era policies. In the mid-1980s, you see a high rise in drug-related arrests. In 1989, drug-related arrests were 2.5 times higher than they were 8 years prior, as found by the Stanford Law and Policy Review in 2019. So in terms of my solutions now, one, I think it's really important to look at what other countries have done in relation to drug abuses and whether they worked. And one great example of this is Switzerland. So as the North Carolina Health News noted in January 21st of 2019, Switzerland used to have a really drastic drug issue, especially through the 70s, 80s, and 90s. And so instead of doubling down on policing, they shifted away from that and moved towards what they call the 4 pillars: harm reduction, treatment, prevention, and reduction. So, and then specifically reduction of criminality. So in terms of harm reduction, they gave people who had drug addiction safe, sterile needles. They also established centers where people could go to get their drug doses from a medical personnel to ensure that they did not overdose. In terms of treatment, Switzerland ensured that there were more hospitals available and more medication readily available to people struggling with drug addiction. In terms of reduction, so this is reduction of criminality and sort of a change in how law enforcement treated drug addiction. They sort of shifted the focus away from the individual suffering because of drug addiction and instead to the high-level people and criminals that were distributing these drugs. And this has helped drastically in reducing crime. So in 1994, 20,000 there were 20,000 opioid-related crimes. In 2019, there were only 5,000. So not only does this help individuals in a sort of personal level, it also helps society reduce crimes. More on an international level, as the Latin American Review in 2021 stated, America needs to be less interventionist. As we can see with Mexico, our imposing of the war on drug policies has only worsened their crisis. At the very most, we should be encouraging them to establish rehabilitation and regulation-focused policies. So in conclusion, I think sometimes what happens with complicated issues like drug addiction, we look for simple answers, but simple answers do not effectively answer the question, comprehensively answer the question, and in this case, it lacks the humanity of looking at people not as moral failings, but as people struggling with a serious health issue. Thank you for your time.